So let's get the latest update on COVID-19 now. And of course, in anticipation of hearing from President Cyril Ramaphosa later this week, we are now joined by Health Minister Dr. Zweli Mkhize. Minister, good to have you. Welcome to the show again.
Good morning, and thank you very much. Thanks for having me.
It's an absolute pleasure. Thank you. Are we hearing from the President this evening?
I wouldn't be too sure, but I hope we would. But I think the President would have to give us the exact times.
Yeah.
Whether it's today, most likely, but I can't be certain.
Okay. So you had meetings with him yesterday. How did that go? He had a lot of meetings yesterday, in fact, about the situation.
Well, I only had one meeting with the President, and the rest of the other meetings I wasn't part of. But one of the meetings are meetings that we have to have as the members of cabinet, and so those meetings went on very, very well.
Yeah, good. I mean, let's look at the infection rate that we got last night, 772 new infections. I mean, this is the lowest since May. It's very, very significant. So let's talk to this. We've seen this dropping all the time, this number.
Well, this number keeps dropping, and it's very, very encouraging news for us, because it effectively tells us that the numbers of people who are getting infected is getting less and less. And when we were looking at the surge, we were worried that it would be extending into August, September, and probably in parts of October, but it has not turned out to be so. So we're actually very encouraged by the numbers. And certainly, to have a total record of positive tests being less than 1,000 is a big thing for us. And also, as it was just getting less than 2,000, it was very, very encouraging already.
It certainly is. However, I mean, the death toll is also still relatively low, and we did have, a bit of a higher death rate coming in yesterday. However, there's still the talk that the death toll may be higher than what is being reported on. Perhaps you want to update us on this.
Well, firstly, the daily records don't necessarily give you the best of the picture. So we just look at the week before and the week thereafter and look at how it's going. There's been quite a steady decline in terms of over 15%, about 22% decline. And so it tends to give us a sense of an average of a week. Sometimes the daily averages are affected by the counts when were they able to finish reconciling the body, the total numbers of people who are deceased and so on. So all of that creates a bit of a delay. So the numbers can't be accurate every day, but they would then be averaging out over a week, which for us is important to indicate that the trend is a downward trend. The recorded deaths are declining, which is compared to the same recorded deaths that were high in August, in July. Then the other question that keeps coming up is that of what we call the excess deaths. Now, this is a report that we do every week, every month, to be able to look at how many more people are showing that we have lost as compared to the same time previous years. So that it gives us an indication that over the time of the COVID period, those numbers started increasing, which was indicating that there might be people who might have died because of COVID, or others may not have died of COVID, but that there would be more deaths that are associated with the time during which we're going through a pandemic.
I'm quite interested to look at something that came out yesterday, and it was something that was, I suppose, taken for what you were saying, that revised models could actually show that about 12 million South Africans may have been subjected to coronavirus. And this is, of course, with all of the antibody tests that are being done, basically estimating that 12 million people, nearly a fifth of the population, may have contracted coronavirus. Talk to us about this. Where are we getting these numbers from now?
Well, the numbers work this way. I'm not sure about the report you're talking about, but the 12 million comes from a figure that is a general assumption we make. What would we need how many people should be infected before we can get basic herd immunity? So the figure would have to be around 12 20% of the population, which would be about 12 million people. That's what the figure is. But it's helping us as we're doing negotiations for vaccines to get an estimation as to how many people we are likely, how many vaccines we're likely to need. So that's what it's all about. Right now, nobody really knows how many people have got immunity. We've done some very interesting reports from the UCT and from WITS. They've done what we call sentinel studies, where they take people who are coming to hospital for other reasons and they take their blood and check for antibodies. They have found that there are variable numbers of people with antibodies, which are much more than the numbers that were actually shown to have been infected in the area. So, for example, around the Western Cape, the figures went up as far as about 37, 40%. In Gauteng, some of the figures were about 29%. But you see, we caution quickly to say, don't interpret that to mean that this is what is there in the population, because the people who are the specimens that are being tested are people who have come for other reasons. So it's a selected sample. It's not a random sample which gives you a proper picture. So there will be a huge study that's going to be done. It's going to take us probably about 2 to 3 months to conclude, to just get a survey right across the country as to how many people have already got the antibiotics. But the fact that there are more people exposed to the virus already with antibodies, it is that number is more than the numbers that we've already reported as positive. So we should expect that there should be a few more people who are actually having antibodies than those who are reported as being positive. That is really mainly because many people have the virus without symptoms, and some they got exposed without going to test. At the peak, many people got exposed and they may not have been aware.
Yeah, and that was the whole thing, is that some people may have been completely asymptomatic. They didn't even know they had it, and built up some form of immunity. But let's talk to immunity for a little bit, because there's still, there's still the unknown about how long you may be immune to coronavirus, if you can be reinfected, how bad that reinfection is. What are the latest studies with regard to reinfection and immunity?
Well, there are kind of 3 types of common antibodies that we look at. One would be IgG, IgM, and IgA. IgA is the one that the mother passes to the baby through the breast milk, so we ignore that. Then the tests that get done are tracking antibody IgM and IgG. The one comes in early within a week, the other one comes in about 2 weeks or so. So we check that and see how many people are infected. But because of the fact that those don't tell you whether the infection is current or is historical, then we don't use those tests quite frequently. That's why we use the PCR test. So this has been the way of testing, people to see whether they've been exposed. There are now a few cases which are reported of people who might have had exposure that are getting reinfected. This is a phenomenon that is it's not very common, but it's also still very puzzling to the research communities and all the clinicians. Their assumption is that it may well be that depending on the dose of the infection that the person was exposed to, the antibodies may last shorter or longer, and depends on various other factors in the human body. So in some instances, people will have antibodies lasting for a short period, in which case when they get re-exposed, they can be reinfected again. In some area that needs to be studied for much more, but a few instances have been reported in the country. We're not worrying yet about them because we're basically saying it's a minority of cases. The majority of people still don't get the infection because don't get reinfection because the virus doesn't seem to be mutating. So it's all new stuff that we have to learn. We've seen it in very different countries, but we wouldn't say our people must worry too much about it. If it happens, it will just be one unusual case, but then it doesn't change our approach to the treatment.
Yeah, it certainly doesn't. But we also have to look to other countries as well, because as much as we may be celebrating, which, I mean, we have to be very dull in our celebration, there is still the possibility of a second wave, firstly, and we'll talk to that. And we also look around the world, and I mean, we just take India into consideration, and India, I'm just seeing, has now passed a very grim milestone. I mean, they, I think, have now just surged past 5 million cases. I mean, we're seeing at times just under 100,000 cases a day coming out in India. So let's talk to the concerns with regard to what's happening around the world and also that second wave that we may see coming in.
Yes, actually, it's a very, very important point to raise at the end, because the problem of passing the surge is complacency. The problem of people not having been infected is to assume that they may not even get infected, whereas we are not over the COVID pandemic yet. What we have done is just basically to get over the wave of the surge, but the virus is still there. I mean, we talk about 700 cases, but in a week, we get close to 10,000 cases of a new infection. That's still a lot, and we therefore need to understand that we're not out of the woods yet. The real risk is when this whole pandemic surges up again. It has happened in the US, and when it happened there, the surge came up to be worse than the original, the first wave that hit them. India is coming up very strongly. Spain had reduced the numbers to quite drastically low, but then, of course, it's starting to surge up. You're seeing in Iran, you're seeing in Korea, you're seeing in China, they're also getting worried about reinfection and so on. So the patterns now are never the same, but the risk is there. So what we need to say to South Africans is that, the fact that this is coming down now doesn't mean that it is gone. So we will continue to monitor and ensure that our surveillance detects what's happening. But what is important is to keep what we call non-pharmaceutical interventions, where people use masks and wash hands and sanitizers and so on, distancing, because that reduces the risk of the spread of the infection. Even if we could say that some people, as I was giving an indication on the Western Cape, that they were up to about 30% of that sample. It's not representative of the whole country. But even if the country had 30% or 40% of the antibodies, of the population with antibodies, you still have the 60% that's vulnerable. Your biggest problem will come when the 60% gets infected. So we must always know that the risk is still high, even if there could well be antibodies showing that there's immunity on some of the people. There are too few to be able to make us feel safe.
Yeah, and that is a big concern, because you're seeing now a lot of people are getting very relaxed. I mean, we're seeing people going out in numbers. We're seeing some people now not even bothering wearing masks and going back to their normal lives as it was before COVID-19. And that is a very concerning sight, I must say. And one of the big things, and I think let's focus on this a bit, is teens and young adults, because we've seen what's happened in other countries around the world, where suddenly this has been a very, very big population, or part of the population that's been infected, because they're going out, they're going back into their lives and socializing and mixing and, starting to live again, and they become infected and become those that infect. Let's take a bit of time to talk about that segment of the population.
Well, it's actually a serious concern, because the nature of the infection is that there are more young people who are infected than elderly people. Now, partly that has got to do with their lifestyles. Something has got to do with the fact that they easily catch the infection, they move on. At the younger age, below 18 years, they tend not to be too highly infected. But from around 25, 30 going up, they actually constitute a major proportion of those who are infected. The only difference is that they tend to be asymptomatic or mildly so, and therefore they can, get through the infection without noticing or without going through a difficult period. Even the fatality rate is much lower at that level. The real problem is that when that infection is passed to some of the older citizens, from about 40, 45 to 60, 50, 60, and the mortality rate increases. So you may actually escape the infection, but you may actually infect your elderly mother or father or grandpa or grandmom. And that is where the risk is. And that's what we're trying to explain for everyone to understand. It is still important that the younger people take the precautions and not say that they will not be infected. The difficulty sometimes with fellow South Africans is when people feel that, well, I've got a right to not to wear a mask and so on. And if you have to be hard to enforce that, you now need to bring in police to do that. Now, that's not the way you deal with this kind of situation. This situation needs to be based on people having to understand they've got a responsibility to protect themselves and protect others. And that, in fact, one person can actually cause a devastation on a whole community by the way that they behave. And therefore, it's important for us to take responsible conduct and ensure that everybody behaves properly. And so for young people, the message has to be use the mask, distancing, sanitizers. Even if you think you are not going to get infected, or even if you think you might have been infected, whatever the situation, when you are in the public space, please make sure you take the precautions.
All right, let's quickly move on to what, in your vision, level one would look like. That, of course, is if the president does move us down to level one, and all signs and hints are moving in that direction. But from your perspective, what does level one look like? I mean, are we going to be, if you had to advise, would we open up the country's borders to international leisure travel? Would we ease the restrictions on alcohol? Would we allow large gatherings? I mean, these are the kind of things that are being spoken about, and the pressure that's coming in from different segments. Let's perhaps speak to that. What does level one look like through your eyes?
Well, fortunately, it doesn't have to be in terms of how my eyes look at it. It has to be a general decision that is taken by the president, the cabinet, the premiers, the various departments. Everyone has to make an input and look into what are the areas that are of concern, and the Ministerial Advisory Committee or expert groups. So it's a whole consultative process that no one person can really determine what should happen. Largely, we think that we need to be moving closer to the normality, the pre-COVID normality, which means, therefore, that some of the restrictions that relate to issues of traveling, borders, use of alcohol, and some of those restrictions would obviously need to be relooked at, and to the extent to which that will be done will depend now on what the total combination of all the submissions that would have come. And we'll get that when the president makes the announcements to lead the country into the future. So I won't be able to predict all of that as we speak. However, I think that the fact that the numbers have decreased means that for South Africa, we need to move closer towards normality. Although I need to hasten to say that our normality must be new normal. There are things that we will not be able to get rid of. For example, huge meetings, sports, and so on, they still remain risky. Some of the big gatherings, whether they're church or social, some of those remain very risky areas for super spreading events where one person can infect too many people and cause a huge, wave of an infection. So the cabinet and president will then have to work through a lot of those to be able to see how to guide the country as we move forward. But I think that some of the reductions in the numbers are indicating that certain restrictions, such as the issues that relate to the alcohol and the issues of some of the big meetings, having to make certain concessions of some sort to just help people to get along. But there are things that we will not be able to do until we get a vaccine. So we need to then keep that understanding that there will never be back to normal like we used to be before COVID. So that is what we have to keep in mind. But it's important to always work together with government, with the guidance that the president gives to say, at this point, this is what we suggest needs to be done, and let's all do that so that we can move the country forward. Certainly, from now into the future, we do expect that the numbers will stay low, but we are worried that if people, will take advantage of anything, if the president says, okay, this and that can now be done, when people are going excessively on those, it can actually stimulate a new surge. So we're worrying about that. We're waiting to see how any easing of restrictions is going to give us a flip back on the infection. So we have to keep that in mind.
Yeah. Businesses going back. I mean, there's so many people working from home still. They're doing business remotely. Do you think that this is still a good idea, that people do work from home and big offices and hundreds of people going back into one building, air conditioning and all of that kind of stuff? Would you recommend that possibly would be one thing? I mean, you mentioned there would be things that should stay in place and we should look towards those things, at least alleviating the problem. Would that be one thing?
Well, I think some of the areas here, we need to look at the structure of this facility. Firstly, there has to be proper ventilation, there has to be proper distancing. And if that can't be afforded, then of course, I think working from home is still a good idea, particularly for those with comorbidities. But I think with the reduction of the numbers, more people need to get back to work. And so there has to be a kind of balance between the two. We really are not looking forward to overcrowded, halls again, where people are going to be working there and not even worrying about how far apart they are standing. So that has to be taken into account. So I think all we can say is that we have to do things now in moderation. People will have to get back to closer to normality, but the normality is now different.
Yeah. It's got a very different look. Two very quick questions. International borders. I mean, obviously, we have to be very cautious because there are certain countries that are not doing very well. And if we do open those international borders, again, I'm really pushing the boundaries with you because this is not your decision. Obviously, you just have meetings and give recommendations. But I would imagine that there would be a bit of a worry that new strains could come into the country if we open up too fast.
Well, not necessarily so. Firstly, around the African continent, the numbers are not showing to be very high. So I don't believe that there's a country that's more riskier than South Africa. And therefore, because of the way we exist together, we wouldn't be too concerned about the opening of those boundaries, and therefore we might probably need to take certain precautions. So I think that's one area. Then when it comes to international, at a certain point, when the numbers are lower, we need to consider the fact that international travel drives the economy. Tourism stimulates a whole lot of other areas. It's business about it, it's leisure, it's hotels, it's restaurants, it's a whole lot of areas that do depend on it. So we will have to get back there. And the question of riskier countries, I think we'll have to go easy on those. On a country-by-country basis, we'll have to watch how that's happening. But at the same time, we need to understand that people also can't be policed. People can reroute. So you can have a very risky country on the one side, but at the same time, people can go via another country and therefore still come into your country. So what will be important is our own precautions as to how we reduce the risk of those who might be coming in. At some point, the borders have to be opened. Yeah. As to when that will be, of course, the president will have to guide us, but at some point they'll have to be opened, and in so doing, we need to make sure that there are precautions taken.
All right, Minister. So 8 o'clock tonight, we'll hear from the president, I'm sure. He'll tell us more.
Look, I think the president will give us the exact time. So when we know, we will then come and tell you. But at the moment, I think let's leave it for the president. I also think that it's not necessary to put the president under pressure. When he's ready to address, we'll be ready to listen to the president.
You know I love putting you under pressure. Minister, thank you again. I know you've got to get off to cabinet, so quickly go. Your team are shouting at us. You better go. Thank you always for being so generous with your time. It's an absolute pleasure. Minister of Health, Dr. Zweli Mkhize, talking to us about COVID-19. All right, I tried, Sakina. I tried. I really did. You saw. I pushed every boundary I possibly could. I began and ended it with it. So you're going to have to wait.
You tried very hard.
I did. Anyway, you got some news headlines.